BUILD is a national initiative that aims to create a new norm in the US, one that puts community-centered partnerships at the center of improving health for everyone. There are communities across the country that are working together in multi-sector partnerships between hospitals and health systems, health departments, community-based organizations, and community residents. So BUILD is an acronym. It stands for Bold, Upstream, Integrated, Local, and Data-Driven. And that's really the core pillars of what BUILD communities are doing. They're making bold, sustainable, transformational changes in their community, focusing on policy, environmental, and systems changes.
We were at the Oakland Redistricting Commission meeting till 1 in the morning, advocating for an extension in the deadline so that they can engage the community in the planning process. And then they successfully won that extension and were able to really engage community members who wouldn't have been activated otherwise. The champions were serving as trusted messengers in the community to engage in the outreach and the engagement.
They are working upstream. They're looking at the drivers of health in their community, not just the healthcare treatments downstream.
For many years, residents of the community have advocated for a grocery store or some type of business where they can get fresh and healthy food. But to this day, that has not happened as it relates to a big box grocery store or any type of grocery store chain coming into the community. A few years ago, we had the opportunity through the Build Health Challenge to realize a dream of the community, which is to have access to fresh and affordable food.
They're integrated. They're aligning the vision of their partners while bringing each individual partner's assets to bear at the table.
So all the people helping with the work aren't all healthcare people or aren't all the same kind of healthcare organizations. So we have churches, we have the community members, of course, at the center. We have like our cooperative extension, government, healthcare, school system, all working together to address issues in the neighborhood that are preventing residents from having good health.
They're working locally. This work is grounded in community residents. They're not only the recipients of the work, but they are also the drivers of the work. They're the decision makers, thought leaders, and guiding forces for the partners.
You know, being a member not only empowered our voices, and we learned how to use them, learned how to articulate the things that we need for our community, but we also knew that we weren't alone, right? Just being a resident, being a homeowner in that area, you know that there are shared concerns, and you know how to elevate those concerns.
Data is not only driving our understanding of what health outcomes are in the community, but also is iterative, is driven by the community, and is informing what actionable change is working.
One of our key pieces of the project was to provide a way for parents to find safer, healthier housing. We started with public records for lead investigations for children who have been exposed and building and housing structural issues being housed in separate databases. And what we wanted to do was simply put together a portal that would allow a parent who is looking for healthy housing to find information on the house they were looking at.
So we're moving upstream to address health problems before they start, before people land in the doctor's office, by changing the community conditions that cause communities to have inequitable health outcomes.
I would say one of the greatest things that I've seen, and it's been really exciting to see, is when we talk to the residents. They understand the link between health and where they live. That big picture vision. And that is so exciting and they're fired up. They're fired up to advocate. They're fired up to basically take it to the next level.
We brought them together so we knew the issues. It was about action-based solutions.
I tell people all the time, we're getting healthy one community at a time.